Hello everybody, welcome back to my channel, or if you're new here, welcome to my channel. I hope you're all happy and healthy. For those of you who don't know me, I am a first-time mum. I have a 17-month-old baby girl, and I'm also 20 weeks pregnant with baby number 2. I am also a gym owner and a pre- and postnatal qualified personal trainer. Today's video is going to be all about exercising during pregnancy, the do's and the don'ts. I feel like there is so much conflicting information out there about exercising during pregnancy that for general population that don't really know what they should be doing, it can be paralyzing, and that leads to women actually just doing nothing because they just want to be safe and make sure that they're not going to do anything that's going to harm them or their baby. And honestly, exercising during pregnancy is safe, it is recommended, and it is one of the most beneficial things that you can do for both you and your baby. Even if you've never exercised before, it is now recommended that you start during pregnancy. There are many benefits to exercising during pregnancy. It can reduce the aches and pains that come with pregnancy. It can improve symptoms of constipation and bloating. It may decrease your risk of gestational diabetes and the chance of having a cesarean birth. It can also lower your risk of preeclampsia. It promotes healthy weight gain. It improves your overall fitness and strengthens your heart, lungs, and blood vessels. Exercising during pregnancy can also set you up for a smoother postnatal recovery and help you feel a little bit stronger in your body once the baby has arrived. There are some conditions in pregnancy where exercise is not recommended, and if you are pregnant, you would have been told this by your medical professional, but it is always advised that you check with your medical professional before starting anything new, or if you're unsure. So the old advice for women, and you might have heard it, was when you're pregnant, put your feet up, just rest, don't lift anything heavier than your handbag. But that is like outdated advice really, and like I said, it is now advised by the RCOG for pregnant women to engage in at least 150 minutes of moderate intensity exercise a week and to do muscle strengthening activities twice a week. I'm going to go through the do's and the don'ts of exercising during pregnancy, so hopefully by the end of this video you have a better understanding and you feel a little bit more confident about engaging in activity. So let's just get straight into it. I think we will start with the don'ts because there are more do's than don'ts, so let's get the don'ts out of the way first. Number 1 is going to be do not overexert yourself. If you are new to exercise, we recommend exercising at an effort level of about 5 to 6, and you can gradually increase that as time goes on. If you are not new to exercise and you're either experienced or more of an athlete, then we do say that a 7 to 8 can be used for effort level. So 1 would be really easy, 10 would be really, really hard, but no more than a sort of 8.5, even if you are like an athlete, and you should be working with a experienced coach if that's the case. Number 2 is going to be don't do any activities where you could bump the bump. So that includes anything with like barbells, that might be like cleans and snatches. As the bump grows, there is the risk of you hitting the bump. Any exercises or activities where there is the risk of falling, so horse riding or skiing are not always recommended in pregnancy. And also boxing or kickboxing, again, unless you are a professional boxer and you are working with a specialised coach. I have seen pregnant women that continue their boxing through pregnancy, which I just think is so amazing. But for the general population, if you've never boxed before, probably not a good idea to go and start boxing during your pregnancy. Also, no extreme sports, so deep sea diving or anything where you're at risk of overheating, like hot yoga or anything like that. Tip number 3 would be do not exercise if you are really struggling with morning sickness. So this is more common in the first trimester, but it does happen through all trimesters, and some women do feel really sick all the way through their pregnancy, unfortunately. So if you do have severe morning sickness or a condition called hypomesis, where you literally cannot keep any food down and you are unable to eat many calories, it may not be a good idea to go and exert a lot of calories through exercise. Some gentle stretching or mobility movements may help you feel a little bit more comfortable in your body, but when it comes to any higher intensity exercise, is probably not recommended. And if you're like I said, if you're not eating and keeping food down, it probably would benefit you more to rest. The final don't would be do not exercise or push through any exercise if you were experiencing the 5 Ps. The 5 Ps are something I learned from Nikki Bell. She's the Bell Method on Instagram, another really, really good person to follow. The 5 Ps are pain, pressure, peeing, popping, or peaking. So obviously if you are experiencing any pain anywhere, please do not push through that. That is your body telling you something. If you are experiencing any peeing or leaking of any fluid, whether that's amniotic fluid, urine, or obviously blood, Do not exercise, do not push through that. Pressure, if you have a feeling of pressure in the pelvic floor or into the belly and it's like a heavy pressure, a heavy feeling, that may be a sign that you need to change your breathing strategy. Even if you change your breathing strategy and modify the exercise, if you're still feeling that pressure, listen to your body, it's telling you something, stop. Popping, if you have any sensation of anything popping in the body, it's never normally a good sign. Do not push through that. And peaking, this refers to doming or coning of the belly. So if you haven't seen that in pregnancy, it's where your belly sort of goes into a peak. I might be able to show you if I lean back here with no core engagement. You can see how my belly is peaking and going into this peak here. That is a sign that you are not managing the pressure inside your belly. So you want to either change your breathing strategy, modify the exercise. If doing these things does not stop the peaking, it may be a sign that you need to eliminate that exercise for now. This is more common like in the 3rd trimester when your bump is really, really big. Obviously, as your bump gets bigger, things get stretched. Diastasis recti is a very, very normal part of pregnancy, but there are things that we can do to prevent it from becoming very severe and needing help healing postpartum. So if you're seeing any peaking in the belly, change your breathing strategy, modify the exercise, listen to your body. If doing these things does not help, maybe time to leave that exercise there for now. So moving on to the do's now. Number 1 would be do speak to your midwife, your doctor, your medical professional before starting anything new, or if you are just unsure about anything. You just want to make sure that you have no contraindications and exercise is going to benefit you and baby. Number 2 would be do change your attitude. Now this can be massive. So if you are someone who is used to exercising for weight loss or changing the way your body looks or for shooting for performance goals, now is the time to leave that attitude at the door and just focus on moving your body. We actually want a healthy weight gain during pregnancy, for it's important for the development of your baby. So we really don't want to be focusing on doing exercise to lose weight or anything like that. Also, when it comes to training for performance, if you are an experienced lifter, it's just not appropriate to be working at the effort level that is required to see new personal bests in the gym. So now is not the time to be shooting for new records and new personal bests. That being said, if you are a newbie and you've never exercised before, but you're thinking about starting during pregnancy because you want to have a healthy pregnancy, then you may hit some personal bests, because as time goes on, you will feel stronger if you've never lifted weights before. So in that case, yes, you could hit some personal bests, but we just want to remember that it's the effort level that we're working at should be appropriate. Brianna Battles is an absolutely amazing pre and postnatal professional out there. If you don't follow her on Instagram, I recommend going following her. And I've heard her talk about the term athlete's brain before, and I think this is really, really important. So if you are someone that is a regular exerciser, in pregnancy we can sometimes get something called athlete brain, where we really find it hard to leave that side of us where we're constantly striving for more, constantly trying to hit personal bests. So that can be something to look into. Look into Brianna Battles and the athlete brain. Number 3 would be do use the talk test. Now the talk test is a good way of testing what kind of effort level that you are working at. So remember, we want it around a 7 or 8 in pregnancy. So if you're exercising really, really hard, you're unable to talk, you're so out of breath, you couldn't have a conversation. In pregnancy, we actually want to be able to talk, because that is a sign that the effort level is appropriate. If we are so out of breath that we can't talk, that means we're not getting enough oxygen in, and if you're not getting enough oxygen in, then neither is baby. So you can use the talk test to make sure that you're keeping the effort level low enough. Should be able to, talk to the person next to you. I'm not necessarily saying you should be able to sing me a full-blown song, but you should be able to say something to the person next to you. Number 4 would be do learn how to diaphragmatically breathe. I'm going to do a separate video on this, so I'm not going to go into too much detail about it, but in pregnancy, lots of changes happen, and changes to your posture can affect the way that you breathe, and it can affect our ability to be able to take a really deep breath, especially as the bump grows. The diaphragm can get squished a little bit, so our ability to take a nice full deep breath becomes restricted, and you may see, like I am now, some pregnant women, or most pregnant women, get very out of breath. So it's a really good time to learn and educate yourself about diaphragmatic breathing, also how our breath is connected to our core and pelvic floor, and this will also set you up for your postnatal recovery as well. So like I mentioned, I am going to be doing some separate videos all about diaphragmatic breathing and connecting your breath with your core and pelvic floor. But learning to breathe, I know it sounds really stupid because of course we breathe every day, we're alive, but learning to breathe diaphragmatically in pregnancy is an absolute must. Number 5 would be do your pelvic floor exercises. Now this is so much more than just doing Kegels and just lifting. Sometimes it's not recommended for some women to do lots of Kegels if you have an overactive or a tight pelvic floor. Sometimes doing Kegels can make things worse. So I always recommend for all pregnant women to go and see a pelvic floor physio for a personal assessment so you can have personal advice based on your body. It is so important to learn how to relax your pelvic floor in pregnancy. A lot of the time we just focus on the lift, but if we're not able to relax, then that's where some issues can arise. So if you think about your bicep, you don't just train your bicep like this, you also let your bicep lengthen. So we have to find length in the pelvic floor for it to be flexible and strong. A strong muscle is one that can lengthen and shorten. And also it's really important for giving birth. If you have a vaginal birth, your pelvic floor muscles need to relax to let baby come out. It is a myth that your pelvic floor muscles push baby out. It doesn't at all. Your pelvic floor must relax in order to let baby out. So if you're doing a lot of Kegels and a lot of lifts throughout your pregnancy and you're not focusing on relaxing your pelvic floor, when it comes to birth, your pelvic floor muscles might be just like this and it might make it a little bit harder for you to birth your baby. So really focus on relaxing your pelvic floor as well as the lifts. But as I mentioned, definitely go and see a pelvic floor physio for some personalized guidance. Number 6 would be do coordinate your breath with movement. So the general rule is to exhale on exertion. So for an example, with a squat, you would inhale on the way down, the lowering portion, everything relaxes. Then on the way up, the effort, the exertion, you would exhale, pelvic floor would lift, and your core would draw in slightly. Basically, your core is a pressure management system, and if we don't coordinate our breath with our movement, a lot of pressure can build up inside, and that pressure can go one of two ways. It can either go out into the belly, and that's what can contribute to a severe diastasis recti, or it could go down onto the pelvic floor, which can lead to pelvic floor symptoms. Sometimes there are other breathing strategies that may help you manage that pressure more effectively, and again, this is why I would recommend working with either a pre and postnatal qualified trainer or a pelvic floor physiotherapist that can just have a little look at your breathing strategies and if you are coordinating your pelvic floor and core the way you should be with your breath. Number 7 would be do focus on alignment. You want to learn how to find neutral, and I say neutral with these little marks because neutral is different for everyone, but generally speaking, we want to maintain a nice stacked position with our rib cage and pelvis connected. This is going to help us use our breath more efficiently. In pregnancy, it's very common for the pelvis to tilt and the ribs to flare. This can put your back into a lot more extension, and that can put a lot more pressure down the midline of the belly. So we always want to focus on finding a neutral pelvis and a neutral rib cage. It can be helpful to think of your pelvis and your rib cage as bowls of water. You never want to be spilling water out of the front, and you don't want to be spilling water out of the back. So you always want to find a nice stacked posture with ribcage and pelvis connected. Pregnancy is a huge event. There are a lot of changes that happen to our body in it. So working on posture with strengthening exercises, especially for the posterior chain. So your posterior chain is the whole backside of your body. So as you can imagine, when we are pregnant, our breasts get bigger, our bump gets bigger, there's a lot of weight out in front of us, and we can become quite rounded and quite heavy in the front. So doing exercises that are going to work the back side of our body, the back of our shoulders, our backs, our bums, the back of our legs is going to be really beneficial for improving your posture and alignment. And when we have better posture and alignment, we have better breathing mechanics, which is going to improve our core and pelvic floor function. Number 8 would be do reduce the intensity and the load you are working with in workout. So I kind of touched on this earlier. Now is not the time to be setting personal bests. Leave that at the door. Focus on how your body is moving, how you are breathing through the exercise, how your body feels. Now is really the time to listen to your body. And I know everybody says that, but really listen to what your body is feeling. Take your time, focus on your form, focus on your breath. And sometimes it can help to think of things as a risk versus reward. So when you're doing an exercise, think, am I doing this exercise because it's actually going to benefit my body, or am I doing this exercise because I want to prove that I can still do it when I'm pregnant? Because sometimes there is more of a risk that comes with an exercise than the reward that you will get out of doing it. So sometimes just weighing that up can be really helpful. Number 9 would be do modify exercises. So as mentioned before, if you experience any of the 5 Ps, pain, peeing, pressure, popping or peaking, modify the exercise. This could be as simple as changing your breathing strategy. It may mean that you need to increase the stability or the incline of an exercise. So when it comes to push-ups, rather than doing push-ups on the floor, as that can put a lot of pressure into the core, doing push-ups with your hands on a bench or even against the wall can just make that exercise a lot easier and reduce any of those symptoms. Reducing the weight, increasing your rest time, reducing the range of motion. So if you are feeling heaviness in your pelvic floor when you squat, it may be helpful to just squat a little bit shallower, don't squat as deep, and it could be just something as simple as that. So don't be afraid to modify exercises. Listen to your body, listen to the signals that it's sending you, adjust as needed. Number 10 would be do continue your core exercises. I know it's a little bit of a scary thing to think about doing core exercises when you're pregnant, but believe me, they are important and you need to do them. There are no safe or unsafe exercises during pregnancy. It completely depends on the person and how well they can manage the intra-abdominal pressure. With that being said, the general recommendation is to avoid, when you get into the second trimester and you start getting a bump, to avoid any sort of core exercises where you are in a prone position, so with the belly facing the floor, things like planks, and also any flexion or extension of the spine. So things like sit-ups, that's flexion of the spine, that's going to put a lot of pressure into the belly, or anything where you're extending your back quite a lot in this way, so back extensions, as again that can just strain that linea alba, the tissue in the belly, which can again lead to a severe diastasis recti post-birth. And my final tip, number 11, would be do stay hydrated. This is so important. Always make sure that when you are training, you have a nice big bottle of water. Every rest period, just take a little sip or two and make sure that you're staying hydrated. This is even more important if it is summer and you are exercising when it's really hot. Make sure if you're sweating, you're replacing that liquid with water. I think that is all I'm going to mention in this video. There are a lot more things that I could talk about. I always recommend seeing a pelvic health physiotherapist, and I do also recommend working with a pre or postnatal qualified personal trainer, whether that's in person in the gym or classes, or online with someone like me. I do offer one-to-one online coaching, so if you would like to work with me, please just drop me a little message and I can help get you set up with that. I also have something very exciting that I am working on coming in the very near future with group online coaching for pre and postnatal clients, so keep your eyes peeled for that one. Thank you for making it to the end of this video. If you enjoyed it, please do give me a thumbs up. If you've got any questions or any other tips for pregnant women, drop them in the comments below. If you enjoy pregnancy, motherhood and fitness content, then please be sure to subscribe to my channel for future videos. I hope you stick around and I will see you in the next one. Take care guys, bye bye.